Good afternoon, everyone, and welcome to our fourth and final winter short of the year. My name is Nora Park and I'm KCATO Manager. Today's session is about sustainability in health research. The session will last for half an hour and then we will stay on the call for questions for further 15 minutes. Please feel free to post any questions in the chat during the presentations, or you can raise your hand at the end and ask your questions too if that's what you prefer. And a warm welcome to Lisa and Adélia, who are our speakers today. And without further ado, I'll hand over to you, Lisa.
Thank you very much. Just share my screen. So thanks very much for the invitation to speak to you today. My name's Lisa Fox. I'm an Assistant Operations Director at the Institute of Cancer Research Clinical Trials and Statistics Unit. And I'm going to talk to you today about greener trials from the perspective of an academic clinical trialist. And the work that I'm presenting in my slides, I've done very much in collaboration with Jess Griffiths, our Sustainability Projects Manager, and Professor Paula Williamson, who's at the University of Liverpool, but who also leads the MRC and NIHR Trials Methodology Research Partnership with TMRP. So the World Health Organization calls climate change the biggest health threat facing humanity. We're currently barreling towards a number of climate tipping points, and our action is neither sufficient enough nor rapid enough to protect us from the worst effects of climate change. But why are we talking to you about it as a group of healthcare professionals? Well, healthcare is actually contributing to the problem. It's estimated that healthcare is responsible for about 4 to 5% of global greenhouse gas emissions, and that equates to about 2.5 billion tonnes of CO2 equivalent emitted into the atmosphere a year. We know that approximately an additional 4,000 tonnes of CO2 emitted into the atmosphere causes one global excess death. So we can estimate that healthcare emissions could be causing somewhere in the region of 600,000 excess deaths a year. And we also know that clinical trials contribute to those healthcare emissions. Clinical trials are crucial to the development of new treatments and the advancement of medical health. But as I've said, they do have an environmental impact. If we want to consider that impact and work to reduce it, we first need a reliable, robust method to quantify it. So I've been involved, along with others, in developing a method and guidance to carbon footprint publicly funded clinical trials. We developed the guidance and we piloted it on 2 of our ICR CTSU trials, and the publication of that guidance development is the top paper here on the slide. Once we'd kind of developed that guidance, we've tested it on a number of trials run by UK clinical trials units. The guidance is intended for use by trialists. You don't need any prior knowledge or experience of environmental impact assessment. You can use it at any stage of a clinical trial, at the concept development stage when you're designing a new trial, once a trial is up and running if you were considering an amendment, for example, or once a trial is completed if you wanted to understand the impact of that trial. As well as the guidance, we've developed a kind of toolkit of resources to help trialists use and apply that guidance. All of those tools are free and open access, freely available for anyone to use. And in addition, we also run monthly training sessions. We run drop-in clinics every month for publicly funded trialists to come along, learn how to do that carbon footprinting, apply it to their own trials, and then once you're applying it to your own trials, we support you in those kind of calculations ongoing. So our data set at the moment that we've published is still quite small. We've published results from a total of 12 trials, and I'll just kind of talk through the high level findings of what we know from that small cohort of trials. So the QR code here on the top right, it takes you to the paper, the full results, and I appreciate the text on this slide is very small, but I just wanted to pull out some key messages. But I think the first key message is that the hotspots within these clinical trials vary. We can't say that a hotspot will always be X or Y. It varies between these 12 trials. And I think that's really important in this early stage of this work. We really do need to consider trials on a case-by-case basis to understand where the hotspots will be if we want to reduce those hotspots. The total carbon footprint varies widely in these trials. So top left is a total of 16 tonnes versus top right is 765 tonnes. And although those hotspots do vary, we are seeing some trends which are starting to emerge. So, for instance, the orange segments are the emissions associated with the CTU staff or sponsor staff, so the people actually running the trial. That's the emissions associated with their offices that they work within and their travel to and from work. In dark blue, this is the emissions associated with trial-specific patient assessments. So these are the assessments patients are having as part of the trial over and above their standard of care to answer the research question, and also the travel of those patients to and from the healthcare provider where those tests are being conducted. In light grey, this is trial-specific meetings and travel. So that's the meetings and travel of the sponsor staff, the CTU staff, so monitoring, audit and travel associated with the trial. But it's not just those kind of direct processes and activities of a clinical trial that can be a hotspot. So in the bottom left, the light blue here, this is a largely decentralized trial. And here we see a hotspot related to data collection exchange, relating to the kind of software and devices that we use to collect the data. And in dark grey, it's not just people that travel, it's also samples and associated with the trial. So this dark grey is laboratory samples and analysis. So we've developed the guidance, we've tested it on a small cohort of trials and published those findings. What are we doing next? What do we need to do next? There's a huge amount to do. We're really pleased to have funding from Wellcome and the UKRI to continue our programme of work in kind of 3 key areas. So first and foremost, we need more data on the carbon footprint of publicly funded trials. We need to footprint more trials. To help facilitate that, we're turning all of our resources into an automated online free-to-use carbon calculator for publicly funded trialists. And that importantly won't just be a carbon calculator, but will be a database of curated activities and emission factors that we will share publicly, fully referenced, open source, publicly available. And also for those who consent to do so, anyone using the toolkit and to carbon footprint a trial will ask if they will consider kind of sharing their results of that carbon footprint into a database to kind of build that evidence base that we so greatly need to do the research on those hotspots to reduce them. So we also have funding to kind of support trialists in the carbon footprinting endeavour, to continue our drop-in clinics, to do as much dissemination and engagement to raise awareness of this as a critical consideration in the design of clinical trials going forward. As a second work stream, it's not just about data and quantifying the footprint, it's importantly and crucially about reducing the footprint. So we want to do research to reduce the carbon footprint of clinical trials. So that's about analysis of the accumulating data to identify the hotspots, start to kind of link where hotspots are with particular interventions, disease types, etc. We don't have enough data to do that yet. We want to develop, identify and appraise mitigation strategies. Obviously, if we're kind of changing the design of trials, we need, because of kind of environmental considerations, we need to ensure they still deliver the research data that will answer the research question, and share those mitigation strategies to help our community inform lower carbon trial design. There's also a work stream dedicated on the application and consideration of behavioural science. Who are the actors? Who do we need to engage? And what are the barriers and challenges that we need to overcome to kind of really get this taken up within our community, in the same way that consideration of PPI and research inclusion has over the past couple of decades? How can we kind of build on and get the uptake of this in a similar way? But crucially, we're just one small piece of the jigsaw. As I'm sure you're all aware, the delivery of clinical trials is a complex sector, and we're trying to work across our sector with collaborators to align what we're doing with the sector. So we are this small piece of academic trialists at the top. We're also working with the pharmaceutical industry. There's a huge amount of work going on in industry to consider kind of reporting of the carbon footprint of clinical trials, but also mitigation strategies and reducing footprint. All of those companies have targets that they're working towards. We're also in discussions wherever we can with regulators, the MHRA, HRA, ethics committees, and international regulators also. I think a huge kind of support for this work over recent years has been sustained by policymakers such as the Academy of Medical Sciences, and in the US, the National Academy of Medicine. And for anyone who's new to this area and wants a kind of nice introductory document, this QR code takes you to the recent report by a joint report between the Academy and the National Academy of Medicine in August, which kind of brings together the current status, where we are, what we need to do, and the resources that are available. So it's crucial that we work with patients and the public in this area. If we're considering changing the design of trials to make them lower carbon, there's some critical kind of considerations that we need to think about with patients and the public. There's lots of work ongoing internationally as well. So we're working with academic trialists internationally who are working in this area to align what we're doing in the UK. And it's all the way around the jigsaw. It probably shouldn't be the NHS, of course, because publicly funded trials run within the NHS often are intervention within a publicly funded trial is a routine care pathway or an adaptation to a routine care pathway. And there's huge amounts of kind of work ongoing to quantify the footprint of those pathways and reduce them as well. So we're working closely with the Greener NHS teams and an organisation called Getting It Right First Time as well. And then obviously academic funding bodies, thinking about how we kind of set requirements and the targets for us as trialists. What's the stick and the carrot going to be to get people to consider this? So whilst all of that work is ongoing and the kind of hugely complex collaborations that are underway are ongoing, what can we all do as publicly funded trialists right now? Well, I'm slightly biased that I co-chair the MRC NIHR TMRP Greener Trials Group, and we're always happy to have new members and would love new members to join. It's an open forum for anyone in the UK, internationally, who is interested in clinical trials from the angle of environmental sustainability. So we have membership from trialists, clinicians, methodologists, patients, policymakers, regulators, etc. We meet every 2 months, but kind of keep a distribution list and kind of share funding opportunities, publications, policy reports, guidance, etc. within the group. It's a really nice, we've also got a group website that's linked on the slide here. We're trying to collate all the resources that we've been involved in developing, but also that we're aware of, that members of the group have been involved in developing publications, relevant publications and resources, toolkits, guidance and training, etc. And those meetings, we kind of invite members to speak and share what they're doing. We really want it to be a forum for collaboration, dissemination, sharing of funding opportunities. And we've kind of established new funding partnerships within the group as well, and trying to discuss and set the research agenda. We also kind of via that group continue our dissemination and training to try and raise awareness wherever we can, and we'll continue to support the drop-in clinics and push for kind of collection of data here so that we can kind of build that evidence base to support the research we need to do. So if you're interested in joining that group, do drop me an email. But there's also existing resources that are available for trialists to refer to right now. The NIHR actually wrote carbon reduction guidelines as far back as 2019. That's a really nice, simple set of guidance about how to design sustainable clinical trials. It's very pragmatic, it's very practical guidance, very relevant to just designing an efficient trial, but it's from a new lens, and really recommend you take a look at that. Like I said earlier, we do start to know where the main hotspots might be, and we could all consider those as we're designing new trials or kind of amending our existing trials. The kind of staff working on the trial, how they travel, so kind of linking in with institutional initiatives to reduce the footprint and emissions associated with staff working in our institutions, the travel that we conduct for a trial, the travel that the patients conduct, the travel that the samples conduct, minimizing that, rationalizing it, and there's huge gains that can be made from some simple angles. I'm involved in a group for the UK CRC that's related to kind of the methodology of clinical trial monitoring, and we've written some guidance on greener monitoring. Obviously, monitoring involves or can involve lots of on-site travel. So we've written guidance on how you can kind of make your monitoring greener. The UK TMN Guide to Efficient Trial Management has a chapter on sustainability. I think Adélia is going to talk a little bit about this in her presentation, but if your organisation is new to this, which I don't think you are at King's, I think you're doing a huge amount already, but the Concordat for Environmental Sustainability of Research and Innovation Practice is a great kind of first stop for kind of setting out how your organisation can think about becoming greener or delivering more greener research from the institutional angle. If you work on pharmaceutical industry or collaborate with the pharmaceutical industry, like I say, there's a huge amount ongoing there. All the big kind of pharma being convened via an organisation called the Sustainable Healthcare Coalition into an industry low carbon clinical trial groups, and all big pharma represented on that group, and we are there kind of representing academia, so kind of working with them to align what we're doing so that we can compare apples with apples at some point in the future. The pharmaceutical industry have their own calculator and guidance document, and they also have a LinkedIn community of practice that you can apply to join if you're interested in the area. So I'll stop there and just end by thanking the very many collaborators who've been involved in the work, without which we wouldn't be able to do any of it. So thank you. Nora, should I stop showing? Oh, Thank you.
Thanks so much, Lisa. And handing over to Adélia.
I'll stop sharing and you can take it.
Yeah. Hello, can you see this? Yeah?
Yeah.
Okay. Now, first, thank you very much for the invitation and for the opportunities to share some of the work we're doing at King's, but also to learn more about what Lisa and the whole thing is doing there. I think it's quite impressive to see the level of coordination in one area that's quite important. So I just want to give an overview of what we've been doing in terms of climate sustainability at King's. So there has been some activities that started in 2006, was the first time that King's published a carbon management plan. And you can see this over the time, there were some sporadic milestones that King's achieved, but was primarily trying to reduce our carbon emission. But a key point was in 2022, when King's decided to make climate sustainability as a key priority for the whole organization. So, and the ways we are doing this is one action was to create the King's Climate Sustainability Transformational Program. I'm part of this. This is a big investment that King's is doing. Total amount of funding is 5.83 million of investment. We are using a significant proportion of this on research projects. We are funding preliminary research to support academics to get in the right place, the right time, with the right connections, with the right data to apply for more competitive grants. But the whole idea of King's climate sustainability is to enable actions across all sorts of groups that in King's. And we worked together with quite a few of them. I listed here to not, oh, I missed this one. Anyway, so yeah, we worked together a lot with the estates and facilities team, with the research management and innovation director. Then we work with the sustainability team, we work close to the research strategy and performance team, we work with King's Academy. So this is all coming together, but we will continue working in terms of improving our operations and service to reduce our carbon emission and impact, but we also want to be leading in these areas. For the education, the ambition is that all students that come to King's will leave King's with an increased understanding of the issues about climate sustainability applied to their career path. And this is not going to be done, the idea is not to do as a separate module on sustainability, but is embedding sustainability through the courses. So there's lots of work with all the faculties to try to map how you can present sustainability and make people think. And in terms of the research, the big aim for the research is to increase the quality, the breadth, and the scale of research. And we have big ambitions also to bring more income, research income. So we set up some targets and we are mapping success rating in grant application. And we got targets to increase the research income. And so far, we are not only reaching the targets, but exceeding the targets. There's much more activities across all the faculties and lots of cross-faculty activities. So it's all very positive. In 2022 also, we created an action plan. So King's produced the first climate and sustainability action plan. And the intention was that every year this plan was going to be revised. This was revised for 23-24. but the plan is quite an extended document. We got 14 key impact areas and hundreds of KPIs. So we were working together now as the KCS transformation program, all the operation activities we got, lots of input, and we are presenting now a new sustainability strategy for Kings. I don't know if you came across this. We promoted widely. There was a consultation period that ended 2 years ago. And we are now trying to finalize this draft to go to internal approval at the beginning of next year. And this works quite close together with the big strategy that Kings is launched in January 26. That's the Kings 2030. So we've been aligned all these documents and all these messages. So it's good that this is coming really high level now. The other thing that Kings does a lot is we produce a series of reports, and in the slides I put the link. I should have the QR code. I put the link of there is all this information is available on our website. So there are lots of reporting that we do, and reporting are important because I think it's an opportunity for us to reflect on progress and the gaps and what needs to be taken more attention, but require lots of work from different teams. But I think we're getting better in getting information together. We're using quite a lot of people, Power BI colleagues from the analytics team, so it's getting better. But the importance of these reports is that they provide evidence for some submissions that we do for rankings. So I think rankings are very important to university for several reasons, primarily to maintain institutional position, reputation, show how influential we are, but also to attract not only students, but also talent. We want people coming to work in Kings because Kings is the right place to do. We're doing the right thing. And if you look at I put here some numbers indicating how successful we're being in terms of the rankings. Some of these rankings are national ones, some are international ones, but we do relatively well. The green one is a new one that is the National Student Survey. That's a survey that students do when they finish their degrees. And we asked, there is an option to include a question on sustainability. So we're really trying to encourage students to feel, because it's an optional question. So we want people, although it's an option for them to respond, because we want to understand exactly the impact of our work. And then we are also engaging with wider initiatives. And here I'm calling a big moment in the UK. That was the launch of the Concord Data for the Environmental Sustainability of Research and Innovation Practice. This is a big effort that's coming from the academic community, the research community, with funders. There's lots of discussions, and the launch document came in April last year that defined the priority areas that they were keen to work on, that involved leadership and the way the systems, infrastructure, procurement, emissions from business and travel, collaboration, partnerships, environmental impact, and reporting data. So all these areas are quite important for us to pay attention. And then as soon as the Concord Data was launched, this follows from some of the funders, mainly Wellcome Trust and Cancer Research UK, launched some statements on the expectations they have in terms of the sustainability considerations applicants are taking in their research, because that they're going to fund. And primarily is they really want people to think carefully how to design their projects, how sustainability could, if they could do the project in a different way that could have a less environmental impact. And this covers all sorts of things, and the way you design the project, or how you purchase your equipment, or the way you travel. So there's a lot of areas that we can explore, and we are trying to provide some guidance on that. There are lots of groups work on this, so next year we might be in a better place supporting colleagues that are trying to apply for grants. And so King's signed the Concordat in May this year, and since then, or even before then, we have been working in terms of updating lots of policies. A big one was the travel policy. There was a big consultation, lots of people contributed to the policy, and we are trying to implement now. There is procurement policy, there's all sorts of work done. And also, in terms of some of the schemes that we are getting involved, they are schemes that are quite nationally or sometimes internationally recognized, and we are trying to get involved because this is schemes that the funders will be supporting. For example, Wellcome identified 146 tools, initiatives that research could use in terms of their sustainability. So the LEAF, that's Laboratory Efficient Assessment Framework, is a very important thing, and thank you for putting the link there. It's a very important scheme for us, and we've done very well. I think our colleagues in the sustainability research team, Marcelo Salierno and Lucy Menage, they are working really hard to get, and we were able to get 100% of all the wet labs accredited to LEAF. We are one of the first universities in the UK to get this. The challenge now is how to maintain this, and we are discovering now that's not only where the department needs to go to the PI, so it's quite a long, lots of long term work. So there is we are also involved in Green Disk, that is involved related to computational things. In 2025, we will launch a freezer challenge to make use of freezers more efficient. So there are lots of initiatives. There are training and workshops. We haven't done much in terms of sustainability for clinical trials yet. Doesn't mean that we don't think this is important, is we were not able, we haven't had capacity to get there yet, but this is going to be in our agenda. And I just want to finalize briefly here with one of the projects, because one thing is to do the way you conduct your research, but I wanted to show some kinds of research that people are doing to support our understanding of climate sustainability. And this is a project led by Mary-Lynn Loughlin, and she is a combination between colleagues from the Faculty of Life Science Medicine with the Geography Department, bringing expertise from aging, public health, primary care, clinical trials, epidemiology, physiology, geography, and environmental sciences. So they're monitoring how they're capturing lots of physiological changes in terms of cardiovascular, renal, immune, gastrointestinal, microbiome changes. They're testing the feasibility to connect data in real world, and also they're consolidating some partnerships. So I think I just want to finish here, and there are lots of information on how to get to us, but also happy to answer any question.
Thanks. Thank you so much, Adélia. I've got a couple of things before we head into the questions. Just a moment, I'll share my screen here. So just a quick reminder that we do have some upcoming training and development events in King's Clinical Academic Training Office. And these are all available to book on our website, which is in the chat. So we have pitching for funding, applying for an NIHR pre-doctoral award, NIHR Insight Discover Research, and then in June we have a date, so please do mark this in your diaries, for King's Clinical Academic Research Symposium. So we will be sharing further detail on that soon, but the date has been confirmed. And then as a last thing, please do also follow us on LinkedIn, connect with us. And if you've got any questions about clinical academic training in King's, please do get in touch with us by email. And I think now we can head to questions. I'll stop sharing. If anybody's got questions, please do put them in the chat or raise your hand.
Or come on mic and ask as well, if that's easy for you where you're sitting. Lisa, may I ask one question? Are you, I've just done the carbon literacy training at King's, so 2 afternoons. My pledges are just being examined by the Carbon Literacy Trust, so hopefully I will actually get my certificate eventually. And Adélia, I think it's a really great initiative. It would be wonderful if we can try and make sure more people get trained. Are you reasonably positive about all of this climate change and sustainability kind of movement, should you say? Are more people interested in these questions in your experience?
That's a really good question. I think so there was some very initial work done to kind of think about clinical trials specifically, kind of back in 2009, and it was like a couple of projects, people footprinted a few trials and then nothing was done about it until kind of 2 or 3 years ago. And I think since the last 2 or 3 years, there really is a groundswell of interest, I think. And so I think there's a huge amount ongoing, and I guess my view is slightly biased because I'm in the community of people who are really interested in it and who are working hard in it and who have kind of got active projects and active funding. So I think that uptake is coming, but I think at the moment it's voluntary and it's being led by people who are kind of personally interested in the area, I would say. I think there is a shift to that. A shift now starting, as Adélia said, CRUK and Wellcome now in their application forms for new research. CRUK, I'm from a cancer clinical trials unit. We go to CRUK a lot. In their applications for new trials, there's a question about, have you considered the sustainability, the kind of environmental impact of this research? And I think it's that kind of thing that we need if we really want to drive change. We need a requirement. And I think for academic trialists, that from the funding perspective will be the thing that I think that's what supported the real uptick in interest in kind of research inclusion and PPI involvement. It's the funder setting that requirement as a stick. But I think also there's lots of benefits as well. I think if you design an environmentally sustainable clinical trial, there's lots of co-benefits of that. It's financially sustainable. It's potentially a simplified design that is easier to deliver in an NHS, which is really under pressure at the moment. And we're seeing a lot of our trusts participating in trials and prioritising commercial research because of the O'Shaughnessy review and the kind of political will and need to prioritize that commercial research. So I think if we, the design of an efficient trial is the design of a sustainable, lower impact trial. So yeah, I think the interest is growing. I think the requirements are coming. I think the Concordat, as Adélia mentioned, a lot of the funders have signed up to the Concordat, and one of the requirements of that is that if you're a funder of research, you will be able to report the carbon footprint of the research that you fund. So and all the big funders have signed up to that Concordat. So the requirement will come. We will have to report to our funders, in time, what the footprint of that. So I think it's coming. It is coming. It's whether it's going to be fast enough to actually, be effective. Be effective, yeah. And I think we really are at a critical crunch point. Yeah, I think there's a really nice quote from the Antonio Guterres, from the UN, that's just like, the action we need is everywhere, all at once, everything everywhere, all at once.
All at once, yeah.
Yeah.
That film title, isn't it? Yeah.
Yeah.
Oh.
I just add one point. I think it's quite important this as well, because although will take time, but the UK is leading some of these discussions. I think it's quite important for us to acknowledge this, that this kind of requirements, eventually we hope that other countries will also start having this kind of understanding. Yeah, and they do say, I think the Wellcome Trust say that you need to cost, because sometimes might cost more for you to travel. For example, if you're traveling by train instead of plane, taking a cheaper, I'm not mentioning any company, but might take longer or be more expensive. So you need to cost this properly when you are applying for the grants. And the funders are, I think they are okay to do that. So it's their commitment to cover the costs for us moving to a more sustainable way.
Yeah,
That's really interesting.
It's a great time point at which to consider it as well, because much of the information, the data that you need, the activity data that you need to calculate the footprint, you need that to calculate the financial cost. So it's kind of, to do that, I can see in time that, and a lot of the pharmaceutical companies are kind of pulling this into their costing model, so that they're calculating a financial cost and a carbon cost of those activities at the point of a kind of concept development. And I think that will be, if we can kind of bring that same idea into the academic arena, that will be a great point to do it. And then, like you say, then if there's a cost differential as well, then it's also included in the funding application at the right time.
May I ask one more question? Sorry, and I haven't looked in the chat, so I don't know. I don't think people are. So I'm going to ask the question. Lisa, again, sorry to you. Adélia, you might have a view on this, but Lisa, I suspect you probably do, about the how we're a clinical academic training office. In fact, the project, Adélia, that you showed, we're funding Mary Neil Loughlin. She's one of our people, so that's really good that she's working on this thing. But I'm really interested in the intersection between how our institutions work and our NHS partners work, and how that works around sustainability, because I'm sitting in an NHS building at the moment, although it's on the King's campus, and they don't have the same recycling as King's does. As a very tiny example, I mean, you're talking much bigger picture than that tiny example. But are there any connections between how Greener NHS talks to researchers that you know of, Lisa? Is it beginning to be connected better?
Yeah, I think it is. I think it is beginning to be connected better. I think that's a really good way to put it. It's really complicated. And I think the Greener NHS team are doing so much, but I think the way you approach this is you go for the low-hanging fruit or the biggest hotspots if you really want to drive change. And I think many institutions, their biggest kind of impact is in their Scope 3 emissions, and Scope 3 relates to all of those services that you procure and acquire. So I think all institutions are looking at those services and kind of starting at that point. And I think at an institution level, that's the way to go, because that's where you can make the greatest gains. But I think the angle that I'm coming from it and our work is, let's let those institutions do that work. Let us do the things that we can control and that we have impact on. And the things that we control and have impact on is the trials that we're designing. So I think our focus of our project work is about giving the tools and resources to the people designing trials that they can consider. And, there's services within that they procure, and those services, like you say, cross research institutions, maybe because you're collaborating with another academic laboratory, but you're running your trial in an NHS institution. So you can't control, how the NHS institution is kind of mitigating and working in the trials that you deliver. But what you ask that trust to do as part of your research, you can control. So I think sometimes it is so complicated, and there's so many webs and overlapping processes. Everybody's Scope 3 probably overlaps with someone else's Scope 1. And I think you can get bogged down in that. And I think there's a lovely phrase about not letting perfection be the enemy of progress. And if we all just keep focus on the bits of the kind of sphere that you can influence, I think that's a great way. That's the kind of approach we're taking. What we're doing is for those people who are designing research, and the institutions also need to attack this from their angle. And people talk about the bottom down and the top up, and that we all meet in the middle. So I think it's hugely complicated, and there is a lot of overlap. And hopefully, if everybody's kind of working on their sphere of influence, at some point those spheres will overlap.
Thank you. Adélia, did you have anything to add to that?
No, yeah, I was thinking here because I know that NHS, although it's a big institution, but each trust has different policies, different ways of doing things. So I think it's quite difficult. Perhaps the way forward is to try to make these connections and work through our projects and trying to bring these principles to our partnerships and our collaborators, and because even inside the NHS you have a massive diversity of people working there. So you might have people that are more inclined to these ideas and people that are less inclined. So I think it gets a little bit difficult. But institutionally, I think there are things we can do. For example, one thing I heard recently, I wasn't aware of this, that King's made a big deal with Dell, the computers. So all the computers we used to buy used to come by a plane. The delivery was by flight. And King's now signed an agreement that we want them to be delivered by boat. That is less emission. The problem is that it will take longer. So the procurement thing and all the other things, they need to plan, the IT colleagues. You need to plan in advance because you're not going to be able to have a laptop delivered next day or in a week's time. But this kind of discussions is coming, I think at King's is coming, all the different teams are thinking how they could, in their space, how they can make the system more sustainable. And I think the Concordat, although we might not like this, but I think it's good that the funders are asking us to think about this, because if it doesn't come from the top, I think perhaps the motivation will be different. And now we're getting together and we're rethinking. And so, yeah.
We have to keep going.
I think we should see this as an opportunity as well to do things differently. I think sometimes if you don't have these drivers, you might keep doing the same thing without even thinking. And sometimes you can do things differently for the better. Yeah.
Super. Thank you, Nora. Should we wrap up?
Thank you so much, Adélia and Lisa. If there are no more questions, I think we're done for today. Thank you for everyone's time as well. And it's our last session, so happy holidays to everyone.